Okay, this video is to coach you through a 15-minute session that's intended to reduce tension and discomfort that affects the upper back, back of the shoulders, neck, and sometimes headache. Here's the equipment that you're going to need. A floor, preferably carpeted, a quilt folded in 2 or 3, depending on if you don't have a carpeted surface, it's going to be thicker. 1 to 3 pillows. I'll explain why you might need 3 in a second. A towel, okay, that you can fold lengthwise, typically lengthwise. Items to rest your legs on, because the first step in the process is to take the weight off of your spine by going into a horizontal position. There is another option other than this for positioning, and that is on your side. And I'll explain that first, and then I'll go on to this one. So if you're going to choose on your side, you'll use some type of folded towel to put above your pelvic bone and below your rib cage. It's going to be a little bit of a larger thickness from the floor to the ceiling if you choose to do that, and depending on your side profile, you may end up switching from a towel to a pillow. You would lie on your side. This would support you where your abdomen is, where there's no bones, there's no ribs, and there's no pelvis, like that. And then you would take enough pillow material so that your head is, the midline of your face is parallel to your chest bone, and the top pillow is going to be pulled diagonally so it can be tucked into the curve of your neck, because the neck is generally narrower than the head, and it's narrower than the shoulders. And so this is one alternative if lying on your back isn't for you, or if you're using a bed and can't get down to the floor. This is often better. Get a long pillow, called a body pillow, and put your arm on it and put your leg on it, and that's your position of relaxation in that case. However, we'll go through the face-up position. So you lie on your back. This is positioned a little higher up your spine, a little lower toward your pelvis, and by trial and error until you find what feels just right. The thing that you put your legs on can again be moved closer to your pelvis or further away from your pelvis until you find what feels nice and relaxing and nice and comfy. The thickness of material underneath your head should be such that your forehead is a little higher or closer to the ceiling than your chin, so you have a very slight nod, and preferably you have some material pulled up and into the curve of your neck, so there's no loss of contact between your spine and a supporting surface all the way from your pelvis to the back of your head. For people who have soreness on the front of their shoulder, putting a pillow beside them so that their elbow is higher than their shoulder, closer to the ceiling than their shoulder is sometimes helpful. You put one on each side of your body. So I've set a timer and chosen some priorities in terms of what you're going to attend to at the beginning of this program prior to doing the range of motion exercises. So our timer starts now for the 15 minutes. Here we go. You've got your positioning sorted out, and now you're going to focus on getting your diaphragm to breathe for you and try to reduce how much your neck muscles do the breathing for you. One of your hands is going to lay on the top of your stomach just below where your ribs are. Now listen to the video and follow my coaching. With yourself as relaxed as possible, draw a breath in through the nose and let it fall out through the mouth. Feel the hand rise as you breathe in, and then feel it fall as you breathe out. Don't be concerned about how fast you're breathing or how deep you're breathing. By paying attention to the rising of your hand and the falling of your hand, your body will find the proper depth and rate of breath for you at this time. Don't focus on breathing deep or shallow, fast or slow. just try to put everything out of your mind except the rising of your hand and the falling of your hand. And you do that until you feel that you're very well aware of the rising of your hand and the falling of your hand. And in the time it took to explain these instructions, you will have achieved some degree of benefit of this procedure. Now we're trying to keep this to a 15-minute duration so it can be worked into busy days. Once you've finished doing that, turn your attention into the pressure between the back of your head and the pillow you're lying on. With every breath that leaves you, try to relax your face. And if you relax your face, does the weight of your head feel more heavy on the pillow? If it does, you have just reduced the number of little muscle cells that are contracting in your neck, which is a better state of relaxation. Attempt to focus on this and achieve this increase in pressure between your head and the pillow for at least 3 breaths out. Keep working on it until you've done, say, around 10 breaths, or you've achieved the fullest change you can, as evidenced by no increase in pressure with subsequent breaths out over a series of, say, 3 more tries. Okay, I'm going to stop this procedure when we've reached 5 minutes so that we can attend to the range of motion exercises, but you can choose to do longer. Once you've achieved the greatest degree of relaxation possible with working on your face or focusing on your face, focus on your front of your chest. With every breath out, focus on relaxing the front of your chest, and you may feel your shoulders fall toward the carpet. You may also feel the weight of your upper back more firmly against the carpet you're lying on. Either of these things indicate that you've achieved some relaxation on the muscles on the front of your chest. Combined with the relaxation you achieved with the previous exercise, you will have reduced the number of muscle fibers that are spontaneously active, and those muscles will be able to relax more, rejuvenate themselves, and not pull your shoulders forward when you're sitting, and not pull your head forward when you're sitting or standing. Same guidelines in terms of how many breaths to try this with. At least 3. But if you're getting somewhere, as evidenced by an increase in weight of your upper back against the towels, or the falling of your shoulders back toward the surface you're lying on, then keep going. If you want to confine your duration of time spent to the 15 minutes, then we should probably move on just now. We're going to move on to neck rotation. Your breath is still going to play a role here. Not deeper breaths or more shallow breaths, just natural breaths. Roll your head from the midline over to the left and feel for the development of a pulse somewhere. When you get to that point, stop. Breathe in. Exhale and relax without changing your position, and see if that tension goes away with your breath out. Try another time, and you'll be doing 6 relaxed exhalations with your head rotated to the left at the edge of feeling stiffness. My third, focusing on relaxing on the way out. Fourth, if you feel a relaxation happen, great. If you don't, after a couple breaths. Fifth, then allow your head to tip back towards Slowly rotate your head out of that position and rotate in the opposite direction. I'm going to continue to look at the camera so that my audio picks up. Breath 1, and the breath leaves you. You feel the slight tension leave you, partially, hopefully. Breath 2, in. Exhalation, feeling a more further relaxation and reduction of that tension. Breath 3, exhalation. Remember, if it hasn't started to feel relaxed by now, back off a few degrees. And then you'll have more success. Breath 5, exhalation, and relaxation. And then your 6th breath, and exhalation and relaxation. Nice. Next movement, you're going to take your hand and you're going to put it over your head. You can watch the video. My head is in the midline. My fingertips of my left hand are going to go just past the midline of the top of my head and curl around to the right side of my head. I'm going to draw my head and slide my head over the pillow toward the left until I feel a little pull somewhere. Pulls on my right side, or even if there's a little bit of a pull on my left side. And now I'm going to start my breath-focused relaxation as I did in the previous maneuvers. In and exhale. Feel the weight of your head resting on that pillow. 2nd breath in. Exhale. Feel the slight pull on the right or the left side relieve you a little bit. 3rd breath in. Exhale. If you don't feel the relaxation happening, give yourself a couple degrees back to the midline. 4th breath in. Exhale. It just falls out. The breath just falls out. Okay. 5th breath in. Exhale. 6th breath. And exhale. Allow your head to go to the midline. Not quick. You don't want to alarm anything. Take your right hand, put it on the top of your head so your fingertips lie on the left side of your head. There's usually a flat spot just above your ear. And then slide your head on the pillow by pulling with your arm. Go slow so that you can accurately detect the beginnings of the pull. Breathe in. Same principles as the previous maneuvers. Exhale. Breathe in. 2nd breath. Exhale. Full relaxation. 3rd breath. Breathe in. Breath is out. Make sure the weight of your head stays on the pillow and you feel nice and heavy on the pillow. 4th breath in. And it falls out. Failure to achieve relaxation means you go back to the midline a couple degrees. 5th breath in. Exhale. If you're fully relaxed, you can sneak your head over away from the midline a little bit. 6th breath in. Final for exhalation for this maneuver. Okay. Next maneuver is hands behind your head, or if you can't get your hands behind your head, fingertips touching your temples. Elbows are pulled to the midline, but not aggressively. Now you're going to breathe out, and you're going to allow your elbows to separate. And here, you're going to actively pinch your shoulder blades together, lightly. Breath in. Actively pinch your blades together as you breathe out, and that'll separate your elbows. 3rd breath in. Pinch the blades together, the elbows separate. Do not shrug your shoulders, allow them to stay nice and relaxed on the supporting surface. Fourth breath in. Exhalation. Legs might come together more, or you may choose to stay put. Fifth breath in. Exhalation. Feeling the arms go toward the surface you're lying on. Sixth breath in. Air falls out. You may still be pinching if that's working for you, or you may just be relaxing and letting the arms fall to the surface. Cool. Now we're going to work on our rib cage. So we're going to take our legs off of the supporting surface and roll onto our side, leading with, I'm going to roll onto my left, so I'll lead with my right hand. And then I'll just push myself up. Be careful not to be too dizzy. And then I'm going to move over to the chair. I'm going to cross my arms. I'm going to sit tall from the side. You're going to have a tall spinal posture. And I'm going to cross my arms on my chest. There's like a string going from the crown of my head to the ceiling. And I'm going to rotate, so you can see from the side. I'm going to rotate to my right. Just like when I rotated my head, I'm going to feel for the beginnings of some stiffness. My head is going to move with my chest. I got my stiffness started there. Come away from it a bit. Breathe in. Exhale and turn the chest. Breathe in. Exhale and turn the chest. Again, you're just knocking on the door of the first stiffness. When you breathe in, you may want to go to the midline of this maneuver. And when you exhale, you may want to twist. Fourth. Again, fifth breath. You may find that you get a few more degrees with every repetition. Sixth breath. You may find that you stay about the same place. And that's okay. Let's turn and do the other direction. You don't have to turn, but you can see me, I'll turn. It's better that you stay in the same place or back closer to the midline to achieve that relaxation than it is to go past the beginnings of that stiffness. I'm rotating to the left, to the edge of sensitivity, breathing in. Exhalation, relaxing, to back knocking on the door of that little stiffness. Breathe in for second breath. Coming to the midline when you breathe in. Exhaling to that edge of stiffness. Breathing in. Coming to the midline. Exhaling. Nice. Breathing in for the third breath. Exhaling while you're twisting, and you're keeping that crown of the head pushing toward the ceiling. Okay. I think this is the fifth breath. Breathing in, come to the midline slightly. Exhalation, go to the edge of stiffness. Final breath, breathe in. And then exhale to the edge of the midline. Nice. Okay. And now we're going to practice bending the chest backward. It's pretty hard to get the area between the shoulder blades, so I'm going to give you some suggestions so that you get the air between the shoulder blades and you don't bend backward from your neck or your low back as much. You can see me from the side. Alright, hands are still on my chest. I'm going to bow forward a little bit. I'm going to keep my eyes looking horizontal. They're not looking up, they're not looking down. My head's horizontal. I'm going to breathe in, and I'm going to stick my chest out as I breathe in. And then when I relax, I'm just going to come to my resting position. Breathing in, this is more of an active backward bending between the shoulder blades. And then exhale. A little different than the previous maneuvers. Try not to shrug your shoulders up when you breathe in. I'm going to breathe in on my third breath. I'm going to lean forward, stick
chest out as I breathe in, keep my head horizontal. And then exhale and return to upright sitting position. Fourth breath, shifting my torso forward, sticking my chest out as I breathe in. And then exhale. Okay, fifth breath, shifting, I'm going to amplify so you can see, shifting my torso forward over my pelvis, in front over top of my thighs, breathing in and sticking my chest out, keeping my head horizontal so that I don't crank my neck backward, and then exhale and return to the resting position, the tall sitting posture. Sixth repetition, breathing in as I shift forward and as I stick my chest out, and as I keep my head looking horizontal, and then exhale and come to the center. And there you go. Less than 15 minutes, and you've got some good work done. Thanks.